Today we are doing a Scarlet procedure, and Scarlet is radio frequency with microneedling. And you can see that I'm doing eyelids right now because it really helps to tighten and lift the skin anywhere. So the eyelids, under eyes, obviously face, jowls, neck, breasts, arms, anywhere you do it, it's gonna tighten and lift. But because this is not a laser, I can go right to our patient's eyelash line to help give her a lift. So basically what happens is there's little tiny needles that come down, and what they do is they irritate, I'm gonna have you look up at me now. They irritate the cells that make collagen, so it makes them make collagen. And then as the needle gets to the depth that I've programmed, it releases a radio frequency, which also irritates those cells that make collagen. So two different ways we're making collagen. Now, as the needles come up, the radio frequency follows, so every single layer of the skin is getting that tightening energy. And once the needles are out, now there's little tiny channels that your skin is going to have to tighten to fill. So you get two ways to make collagen and two ways to tighten and lift the skin. And the really great thing about Scarlet is that there's really no downtime. Maybe a day of redness where you kind of look windburned, but really pretty easy in general. And again, we can treat anywhere. So we're going to go ahead and go to the nose now with this. Generally, we do one treatment a month for 5 to 6 months, and then we recommend 4 treatments a year. So something every quarter. And it doesn't necessarily have to be Scarlet. You can do BBL or Halo or something else next year. But really the whole key is to be doing something that stimulates your collagen every season once you do some kind of corrective treatment. Let's see what else I can tell you about Scarlet. Well, it's pretty smooth. You can see how the needles kind of go in really smoothly because they are tapered. There's 25 of them, and this is one of the 2 machines in the country that actually has what's called the Na effect, and that's the effect of when the needles come up, the radio frequency follows. You doing okay? Mm-hmm. So now we're going to go over the upper lip. So this is great for upper lip lines. So we're going to just keep going here. And those little baby needles go in so smoothly because they're tapered, and the amount of power that this machine has is 2 times the amount of any other machine. So it's a really powerful little lady. Oftentimes we'll combine Scarlet with Agnes, and Agnes will help treat fat. So we can kill fat cells, and then we can tighten and lift the skin where those fat cells were. You're doing great. Now we're gonna go bottom. So Agnes, like I said, is Scarlet's sister. So oftentimes we'll treat jowls, we'll kill the fat pads under the eyes. You can do a double chin with that, get rid of the fat there. If you have lipomas or on your body that usually require surgery to remove, Agnes can get rid of those. If there's like fat right above your knee that you really get annoyed with, Agnes can get rid of that. So really anywhere that there's fat pockets. A lot of times people will have had liposuction and they might have some irregularity where there's a pocket of fat left over. Well, we can just Agnes it. So lots of different reasons to do Agnes, and then again combine it with Scarlet, and you get a 1-2 punch with that. So you're doing great. How you feeling? Okay? Mm-hmm. Good. Now this can be kind of spicy. We did use numbing cream to start, and then we have Pronox, which is laughing gas. So if you really hate what I'm doing, then we can use the laughing gas. Makes everything better. You can actually even go into the scalp, the hairline. It can help, Scarlet can help you grow hair because it helps stimulate those follicles. And it helps to pull everything back too, which is great. We love pulling things back. But you doing okay? Mm-hmm. So, like I said, downtime is just a day or 2 of looking a little red. Really, nobody really needs to know what you've done. They really probably won't be able to figure out what you've done. And then aftercare is really just keeping your skin moist. You wouldn't want to go sleep with your pets though that night, you'd want to change your pillowcase so everything's nice and clean, because there's going to be thousands of open little channels in your skin. So I always tell people, change your pillowcase, don't go mud wrestling, don't jump in a lake, you know, because let these little channels all close up before you decide to do things like that. If you need to wear makeup, you can. I ask to wait 24 hours. And it would also be great is if you bought new makeup, because if you're somebody like me that never wears makeup, you may have makeup left over from 20 years ago that you think still is good. Don't use that right after Scarlet. Buy some new makeup or wait a few days before putting makeup on, because the last thing you want to do is get any little infection in the area that we're treating. I haven't seen any infections, in case you're wondering, but I don't know if you were. And really the only contraindication to Scarlet is if you have any metal like in your body right where we're treating. These are fine. So, you know, there's really not, everybody's a candidate for this.
When do you see the result?
It takes anywhere from, well, it takes 28 days to start making collagen. So your final result's gonna be 3 months after your last Scarlet. But people usually come in after their first Scarlet because, you know, you have all those open channels from the from the microneedles, and you can see it tightening kind of quick. Scarlet's also really great for scars. That's why I'm going after this guy right there a bunch. Okay, let's turn the other cheek. We're gonna do, she's gonna do her Pronox now. Okay, now we're gonna go to this side and do this side, if you could see. And I can also, I could take a minute and show you what those little baby needles look like. So if you can see that, there they are. You can kind of see that they have little tapered ends right there. So it's great to have a visual. We can individualize the depth of the needles to the area that we're treating. So of course the cheeks could use a little deeper needling, whereas the eyelids needed to be a little bit more superficial. Some people's skin is a little bit thicker, some people's skin is a little bit thinner. So we can customize the treatment. The radiofrequency it coagulates. So even though we're making all these channels, the energy of the radiofrequency prevents you from having all the bleeding. And if you're comparing it to something like Morpheus, this actually has double the power. This is the only one with the Na effect, and this has tapered needles. So it's a much more comfortable procedure than that treatment. But microneedling and radiofrequency are great treatments just in general. So if there's not somebody that has a Scarlet around you, you know, radiofrequency and microneedling is a really great way to help stimulate collagen, tighten, and lift. And then you can always fly out here to see me.
Totally worth it.
Yeah, totally worth it. There you go. You can also combine it, you know, like if you, like I said, you could do Agnes and Scarlet, but you can combine Scarlet with other things. So let's say you want to do a breast lift. You can start with Scarlet to tighten the skin, help with the texture. Then we can put PRP in the breast to help with volume, and then we can do PDO threads to help with lifting. So it's a great combination procedure. We also will combine it with a new treatment that we have called Soft Wave, which is ultrasound technology to lift. So the Scarlet will help with the texture and scarring and pores and all that, while Soft Wave treats the deeper connective tissue to tighten and lift as well. So you can combine these things. There's never a wrong answer when it comes to energy-based procedures. The wrong answer is if you don't have a well-trained technician, that's the wrong answer. But all these things in general are gonna make you make collagen, so that's the whole name of this game. How do we make more collagen to keep looking younger? And Scarlet is definitely a way to do that. There's lots of things that we can do in the non-invasive world to help prevent us from requiring a facelift.
What age should you start this at?
What?
What age do you start this at?
Oh, any of these treatments, you can start anytime.
So I love when people started like 30 years ago.
Right? Yeah, me too. When I was 5, right? When we were 5, 30 years ago, we should have started this. But no, we have people that are in their 20s. I mean, because people have acne scars that they want to treat. And, you know, after about 35, we really don't make collagen anymore. So you really, if you can stimulate your collagen, the earlier the better. And a lot of millennials are doing these treatments now. You can even see, I mean, you know, the people on TV talking about all of these non-invasive treatments. So it's become a thing because, again, people don't want downtime. There's no time for downtime. And so today you're just going to want to wash with a gentle cleanser, if anything, or you're just going to leave it alone. And then you're just going to want to keep your skin moisturized starting tomorrow. So Sickle Fade or another type of moisturizer like Aquaphor, Cetaphil, those kind of gentle moisturizers. Vaseline is a no-go because it's occlusive and you don't want to, you want it to be able to, you want your skin to be able to absorb humidity from the environment.